Hello, my name's James Gill and I'd like to tell you a story. Way back in the mists of time when dinosaurs still ruled the earth. Okay, perhaps not that long ago, but 11 years ago anyway, when I was staring down the impending trial of medical finals. In the year leading to those exams, I'd spent the vast majority, or at least a large proportion of my time, in hospitals and on the wards, trying to do as many bloods and simple ward jobs as I could get my hands on. Thus, I was able to reduce a little bit the workload of some of the junior doctors there, and then exchange that for a 5 to 10 minute favour of case-based opportunistic teaching on the wards. Whilst the world has evolved a lot in the last 11 years since I managed to sweat my way through medical finals, the concept of peer teaching has remained an indispensable part of preparation for medical finals. Whether or not that's medical students doing mini medical lectures to their peers in a purely academic topic, such as understanding an arterial blood gas, or opportunistic case-based learning from junior doctors on the wards who've just gone through finals themselves. This circular transfer of knowledge is crucial and unfortunately has been diminished over the last year as a result of COVID. In an attempt to fill that COVID-shaped hole lost to opportunistic learning, Elsevier are launching the Elsevier Live mini medical lectures. Join us for a series of 5 to 15 minute talks, tutorials, case-based scenarios and medical brain dumps on the run-up to finals aimed at bringing you the best in peer learning. Whilst I'm not daft enough to think I'm right all of the time, just most of it, I do have a list of topics that students should know for finals, and this would no doubt be useful, but there's a yawning chasm between what students should know and what they actually need to know. And this is where previous ward-based teaching, opportunistic peer-to-peer learning has excelled. It's fast, it's adaptive, and it covers what the student there and then often felt most concerned about. And that's the thing that you're going to focus on when it comes to medical finals, what you're worried about, what you're concerned about. So, whilst I do have a list of titles and suggestions that have gone out to our students and our presenters, what we've really wanted to do is keep the idea of peer-to-peer teaching alive as much as possible. So, the majority of the presentations here have actually been put forward and will be delivered by those with the closest proximity to finals. With that in mind, join us for these mini medical lectures in the run-up to the end of medical school and those dreaded finals exams. We hope that you'll get the information that you need and the revision that you want in easily digestible chunks. Think more like nutritious snack boxes of information rather than the normal banquet of a formal lecture. Join us on Facebook, Instagram and YouTube and follow at the hashtag #MiniMedicalLectures and you'll see what we're doing. Take care and I hope you join us on the journey. Cheerio.